The basic difference between follicular unit extraction and follicular unit transplantation is obviously just the method by which we harvest the hair. With FUE, we're removing the hairs one by one with a mechanized device, typically as some form of a drill punch, anywhere from 0.8 millimeters to 1 millimeter in size or diameter. Those drill punches run at a very high speed and they extract the hair. It's either going to be extracted by suction or it's going to be extracted by plucking or pulling out the hair. With FUT, what we're doing is we're harvesting a portion of the area. We're removing the hair directly with this harvest procedure. We're doing it under direct visualization so that the hairs are preserved and no hairs are transected. And then all of that hair then is dissected underneath the microscope so that it's better preserved. Now, I don't want to come across as sounding biased towards one or the other, but you have to understand when you're talking about FUE versus FUT, there is a distinction. And the distinction really, the most important one is when that hair is extracted with FUE, as that device goes through the skin, it may pierce it perfectly, but you still have to pull that hair out. And when you pull that hair out, there is going to be some degree of damage to the little fat pad that lays underneath the hair follicle. There's no avoiding it. Sometimes they come out perfect, but many times they do not. When you do follicular unit transplantation, where you're dealing with a harvested piece of tissue, you can directly visualize that underneath a microscope so that you can guarantee that every single hair follicle is perfect.